40-year-old patient has come to the emergency department with increasing dyspnea and chest tightness over the past 2 weeks. Systolic blood pressure decreases by 11 millimeters mercury during inspiration. Physical exam shows distant heart sounds and clear lungs. Echo in this patient will show which of the following findings. Now, this patient is presenting with the classic symptoms of cardiac tamponade. Remember, with cardiac tamponade, we're going to have Beck's triad. First, we're going to have distant heart sounds. Second, we're going to have a decrease in blood pressure by more than 10 millimeters mercury during inspiration. And the third finding is going to be JVD during inspiration. The answer to this question is going to be answer choice C, which is engorged inferior vena cava. The reason why this occurs is because with cardiac tamponade, we're going to have fluid within the pericardial space. As a result, during inspiration, when blood returns back to the heart is not going to be able to relax properly. So we're going to have regurgitation of blood back into the inferior vena cava and the superior vena cava. So the answer is going to be C, which is engorged inferior vena cava. Now, for a more clear understanding, we can take a look at this graph. So here we have inspiration, and then we see a decrease in blood pressure. Again, we have inspiration and another decrease in blood pressure. So why does this happen? It happens because when we inhale, we have more blood returning back to the heart because we're expanding the intrathoracic volume. Therefore, we're going to be decreasing pressure within the chest cavity. So more blood is going to return to the chest cavity because blood likes to go from areas of high pressure to low pressure. So now that we have more blood within the right side of the heart, because we have fluid within the pericardial space in cardiac tamponade, the heart is not able to relax properly. So the blood within the right side of the heart is going to then push on the interventricular septum, and then there's going to be this bulging into the left ventricle, which is then going to decrease cardiac output. So if we are decreasing cardiac output, then we're going to have less blood within the arterial system, and so that is going to then decrease the blood pressure. Now, why do we get JVD during inspiration? Well, it's because we have backup of blood going to the superior vena cava and then ultimately to the jugular veins, and so that it will present with JVD on inspiration. Another finding is going to be distant heart sounds, and that should make sense because we have fluid that is going to make it harder for us to auscultate the heart. So those are the three important findings that we expect with cardiac tamponade. Hope this video helps. I'll see you guys tomorrow.